All right, we are all set up. Okay, so hip pain. Where would you start with hip pain? If somebody's complaining of hip pain back here, the first place you're going to start is that good old psoas release. And I know I've talked a lot about it today, but if this is your first video learning about the psoas release, we really want to think about it in terms of the fascia that's going in and around and telling that psoas what to do. How healthy is that fascia going in there? What nerves are going through here? So if we have low back pain here, we first need to calm down everything up here. This is where we have lymphatic drainage. This is where we have blood flow, and we have meridians, pathways of all the organs coming up through the front or the back that can be affected by this. Okay, so in order to do this, we want to really get deep into the fascia that wraps into the inner making of the muscles that move the joints of the hip. So the psoas is the main one. So we're going to open up this first and then go into pretzel squat. So finding your belly button with your hands, you're going to go 2 inches to the right and 2 inches down. When you have that area, I want you to just pinch it like you have some abundance there. And I want you to lift up, lean over a little, move around, lean it down, do a clockwise rotation, and then do a counterclockwise rotation, just opening it up some. Lean back. All right. I want you to grab as much as you can with that left hand, pressing in and up with those fingers as the main action. Step forward with your left foot, keeping your toes as facing forward as possible. If you let that back toe splay out, it can limit this pull that we're getting here that's going to open up restrictions. So keeping those back toes in. All right, take that right hand to expand and modify this and really grab the upper thigh, but use that thumb to pull away. Find this crease here, and we're opening up this crease by using the right hand in this way. Rotate this hip out. Sorry, rotate the hand out. Once you've got it pinned down with your thumb, rotate the hand out. Lean into that left knee a little bit more and send your shoulders back. Turn your shoulders both ways. Which one gives you more restriction? I'm going to do my shoulders to the left, even though sometimes I send them to the right. Shoulders are going to go to the left. I'm going to look over my right shoulder and I'm going to lean back. This is a deeper modified psoas release than I typically teach. Breathe in through your mouth. 1, 2, 3, 4. Start to move your shoulders and head. 5 and 6. Rotate those shoulders, just move around. One more deep breath and come out of it. All right. Should start to feel a little bit of release happening in the back of that right lower back area, that hip area. Let's do pretzel squat on just that side, and then we'll come back and do the other side for both. So for this one, I want you to tee up your right heel to the inside of your left foot. So your feet are in at a 90-degree, toes pointing out direction. Step out with your right foot, keeping the toes in that direction, and think about how wide you want to go for being able to squat and bend your knees. Here, I want you to remember that it's more important to stay higher in your knee bend and keeping your knees back versus going deeper and letting your knees fall in. That's going to be key in supporting the low back. Send your left hand parallel with the right toes. Both the fingers and the toes are pointing in that direction. Your right hand is going to go on your right butt cheek. Look back over your left shoulder like you're looking at the camera. Left hand is going to rest on top of your right shoulder, relaxing that elbow down. And then your right hand is going to flip up and come up your back just like that. It's okay, no matter where it's at. That's where you're at. Look over that left shoulder and start to drop the left shoulder in towards the middle of your legs, right down the middle. Start to bend your knees just gently. Now, right here, before you go any further, bring up that pelvic floor hold so that your thighs are not doing all the work holding you up. Now bend your knees the rest of the way and keeping it so that your knees are not falling forward, keeping it so that your knees are being sent back. So left shoulder drops to the middle, looking over your left shoulder, knees open and bent, belly button to spine. Breathe in through your mouth. 1, 2, 3. In through the nose. 1, 2, 3. Come up gently, just a little. Switch your arms. So left arm goes palm up your back, right hand to that right shoulder, left shoulder. Look over that right shoulder with your eyes and come back down in that squat with the knees wide open. Breathe in through the mouth. 1, 2, 3. I like to start to bend and sway from one foot to the other on my last 3 breaths. 1, 2, 3, and come on up. All right. If your hips are hurting because of the shoulders, that will actually support that. So just go for a walk and compare your right hip and shoulders to your left side. We opened up the front of the hip first, and then we opened up that rotation of the hips in the back along with the shoulders. Let's do the other side. So psoas release on the left side. Hands go to your belly button, 2 inches to the left, 2 inches down. Grab onto it. Step forward with that right foot a little. Lift up with that abundance, lift down, counter rotate. We're really getting into the fascia. And if you find a certain direction that is more restricted, that's the one you want to hold. Now, I like to, if I'm doing this with one hand, go skin to skin. You're going to grab on with your right hand this time and hold that pin and lock in place wherever you feel it. Take your left hand, especially that thumb, and separate it. Pull down on the skin to find that separation, that tearing action right there in the crease. And then take that hand and rotate it towards your back, sending your elbow behind you. All right, bend into that right knee a little bit more and lean back. Remembering we're pressing away from each other with our hands. Turn your shoulders one way and then the other. Which one has more restriction? I'm going to go towards my right. So that means I'm going to look over my left shoulder for the counter rotation on the upper body. Lean back a little bit more and let's get 3 breaths here. 1, through the mouth. 2, 3. And I like to start to move a little for the last 3 breaths. 4, 5, and 6. And come on out of it. That should help a lot. Shake out those legs. Shake out those arms, those hands. And let's go into pretzel squat on the left side. Teeing up that left heel to the arch of your right foot. Step out about 3 feet, but think about how far do you want to go if I'm going to be down in a squat. Take that right hand and reach out past that left toe. You can lean forward a little bit extra if you'd like. Left hand's going to go right to that right bum cheek. Looking over that right shoulder, I want you to drop that right shoulder down so that you can peek down with your toes. This is the angle that we'll have for the right shoulder. Right hand goes to the left shoulder. Left hand palm flips up your back and lay it wherever you feel that first restriction. Send that pelvic floor hold in place and bend the knees while keeping them wide open. If you start to feel your knees fall in, I want you to come back up a little bit. Look over that right shoulder with your eyes. Let that right shoulder drop between those legs. Breathe in through your mouth. 1, 2, 3, 4, 5, 6. You can come up if you need to. Pelvic floor is holding you up, not your thighs. Switch your arms. Right hand, palm up your back, left hand to the right shoulder. Look over that left shoulder with your eyes, really letting that rotation of the upper body turn to the right, going back down, pelvic floor holding you up. Breathe in through the mouth. 1, 2, 3. I like to sway, and you can choose to breathe through your nose if you'd like. 1, 2, 3. Lifting up, using that pelvic floor or your angel wings. And I like to do a little lean back because it gets deep into that gallbladder channel through the right traps under that shoulder blade, which could be contributing to the hip pain. That darn gallbladder, bladder, kidney area. All right, take a walk and feel how that feels. Any additional maneuvers I would do for this would be pretzel, pullover, hip release, and knee torque. Love you guys.